Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today I'm delighted to be joined by Ryan Witt. He's the Managing Director of the Healthcare Practice for Proofpoint. Ryan, thanks for joining me today.
Delighted to be here. Thanks for the time, Nick.
So for the benefit of the listeners, you're in the healthcare practice in Proofpoint, but tell us a little bit about your background, your experience, and how you ended up in this role working in the healthcare sector.
Sure. So my role at Proofpoint essentially is helping the company take our products and our solutions and make them more relevant to healthcare. And it's something I've been very passionate about for a long time now. I've never worked in a provider sense. I've always worked in a technology sort of role. But I learned very early on in my career that the health industry is something that I just am more passionate about, and the use of technology to go enable digital transformation, something that just stimulates me, something I've been wanting to work on. So, you could choose how you want to go spend your time and where you want to focus your efforts. And it's something I gravitated towards healthcare many years ago. From a Proofpoint sort of standpoint, they decided, as is fairly common with companies of our size, that they wanted to become more relevant to something, the core industry segments, and healthcare was the first one they wanted to focus on. So when they approached me about this mission, and knowing how important cybersecurity or how problematic cybersecurity has become in healthcare, I was very excited to take on this journey and go help them out with that.
Fantastic. So in terms of your background, you said technical. What does that mean? You're a geek, or are you a security? How did you get to this particular point?
So I am a product of Silicon Valley. I'm speaking to you from Silicon Valley right now. The apple orchard that was outside of my house when I grew up eventually became Infinite Loop, or the headquarters of Apple.
Really?
So
no kidding.
Yeah. So
that used to be an apple orchard. I didn't actually know that. That's amazing.
There did, yeah. It used to be a very abundant sort of fruit orchards all across Silicon Valley. Of course, that property is now too valuable for farmland. But yeah, so I guess I fell into technology in the way that if you had a deep association or you worked in Wall Street and your parents worked in Wall Street, you might fall into finance. I just fell into technology because it's just what all my friends did and what my families did. And, before technology became like a very prominent sector, just, so I kind of happened into that way. And so, yeah, I kind of always worked in the realms of technology, but not a deep technologist, more in the business development side of the equation and trying to find the application of technology into the marketplace. So it's kind of how I landed in technology. And then from a healthcare standpoint, I worked in multiple industry segments, and I just found that I felt much better about associating the work I did with healthcare. I think healthcare is by far the most noble mission out there of any industry segment. I am perpetually in awe of what the workers in the healthcare industry do to go help make society better, more so now than ever before, when they're literally putting themselves in harm's way to go try to help humanity. And, I'm very realistic about the role I play in that, because I am not doing that work, but I hope that through the work that I do and the solutions I provide and the technology we provide, we help enable that journey a little bit. So I know I play a very small piece in the puzzle, but given my skill set and given the work that I do, I feel much better about doing that for healthcare than I would do for any other industry segment.
Fantastic. So we're talking about cybersecurity, security challenges, and listeners to my show will have heard a number of shows where I've focused on this. Healthcare, as I describe it, has by far and away the largest target on its back. Has done for years, irrespective of what's currently going on. from a security and information standpoint. Can you tell us a little bit of why that's the case? What is it about healthcare that makes it so attractive for these groups to go after the data? What's going on there?
Sure. I think it's a few reasons here. So first of all, we have to recognize that healthcare data generally is more valuable than any other data. So you have I'm sure your listeners would have heard this many times, but a health record is worth 10, 15, 20 times that of a credit card information. Only part of the equation. The bigger part of the equation is ID theft is a very compelling business case from a cybercriminal standpoint, and access to health information certainly enables a cybercriminal to go establish your identity and to steal your identity. So that makes it very attractive. The monetization angle within healthcare. So there are multiple ways you could monetize a healthcare type attack. So, I mean, you think in terms of ransomware, right, as one of the ways that's an obvious exploit that's being used in healthcare very prominently. But we've done some research at Proofpoint, and we talk about who are some of the most very attacked job functions. And I think we'll kind of come on this later on, but I bring this up in relation to your question because one of the most very attacked job functions within healthcare is the pharmacist or the pharmacy function within a hospital. And the reason for that is they have access to controlled substances, opioids, basically commodities that can be very easily monetized on the black market. So it just goes to the diverse nature of what a exploit or what a healthcare attack can yield from an ROI standpoint. And I hate kind of using those sort of terms in context of cyber criminals, but we have to recognize that they look at this as a business. And so they're looking at business. Yeah, they're trying to monetize their attacks. And if I can go attack a pharmacy function or a pharmacist within a health institution, steal the ability, the credentials or the prescriptions, the ability to go take a controlled substance and go sub out on the black market, that's a very monetizable event. And so that's the reason.
Fascinating to me. So this doesn't actually limit to just identity theft for the purposes of selling identity and creating credit cards. What you've actually found, based on the analysis that you've applied, is that pharmacists are the biggest target within that group, and that's because they have access. And what's happening downstream is that they're using those identities to actually prescribe and gain access to these controlled drugs?
That's right. That's right.
Wow, there's not a single pharmacist I know that's not going to go, good grief, what a problem.
Right.
And now suddenly I'd be paranoid at that
right.
point. That's just shocking.
Right. So that's a very, we call out 4 job functions within healthcare that we find are the most attacked. I come on to that and why we say that in a second. But let me illustrate the point with another job function. So if you have a health institution and you have a clinical research component within your health institution, now, of course, not all of them do, but if you do, then again, our research shows that that's, again, what we would call a very attacked person or a very attacked job functions. So in this case, you're seeing a different sort of attack. You're seeing a lot of, frankly, nation-state actors, bad actors, which are the most sophisticated form of attackers out there, and it's all about IP theft. So they're trying to go steal your research. You've done, that clinical research has done some amazing things. Right. Now they're trying to go take that research. Again, there's a monetization angle to that. So they have that IP, they can go monetize that research.
Okay. Now you've got me really intrigued. What are the other 2? Because you said there were 4, right, in your VAPs?
There are 2. Yeah, the other 2 we call out. One is another healthcare specific job function. So nursing, so the nursing function. Our theory about that is the nurses interact with the EMR, the medical record, more frequently and often in a more frenetic way. So they're multitasking. They're doing it at the point of care. So they're doing it in I call it a frenetic way. So not that they're doing anything wrong or malicious, but they're just having to work at a very high volume pace, high stress, high pressure situations. And so their ability to be duped or tricked or to make a mistake is higher. And because they're touching to a medical record more frequently, it raises their stakes more exponentially.
Right.
And particularly if you are in the leadership realms of the nursing function, and therefore you have access into, the broader medical record, and so you're not just constrained to your patients or your wing of the hospital or whatever. You can maybe have access to the broad medical record. Then your credentials are very valuable to a bad actor as a result. So that's the third job function. And then the fourth job function is not a healthcare-centric function, but it's worth calling out all the same. So it's if you work in a supply chain. So if you have a job where you're working regularly with your business associates, what that usually means is you're frequently downloading files, you're accessing invoices or records, or you're clicking on links, you're working with their apps or third-party apps. And you just work in a highly vulnerable way, just because by the nature of the work that you do. Again, nothing malicious about it, but you just put yourself in harm's way from a cyber standpoint, just from the type of work that you do. And so our hypothesis here is it's no coincidence that these four job functions are the most attacked. We determine this through our research, and the way we have done this is we look at the email activity within a health institution. And email, whether you want to look at HIMSS data or Ponymon data, IDC data, etc., email is it's the initial point of contact, right? Initial point of compromise. So we look at email traffic, and we literally do analyze who are the top 20 most attacked people in a health institution. And we literally produce a chart. And that chart will have, the top 20, top 50, top 100 most attacked email domains. And you're talking about a health institution which might have 30, 40, 50,000 employees. And we're saying, hey, these are the top 20 most attacked. And time again, when we do dozens and dozens and dozens of these VAP charts, these job functions come up time and time again. So after a while, you're like, this is no coincidence, right? The bad actors have done their own research. They've realized who has access to information they deem to be valuable, and they know which people within an institution they should be attacking.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Ryan Witt. He's the Managing Director of the Healthcare Practice at Proofpoint. We were just talking about the most attacked or most targeted individuals. I think, shocking to me, pharmacists were right up at the top there. Clinical researchers, which, hadn't occurred to me, but for some good reasons. And then nursing. And we were just finishing off talking about supply chain and sort of what you described as business associates. And I want to make sure that people understand, I think you're talking about employees within, not the subcontractors that work within the hospital. Is that true?
I'm talking about the people within a health institution who have the job to go interact with your business associates.
Right. So it's not, because there's a term within the healthcare system, we talk about business associates, and those are essentially the people that we do business with, that we have a relationship that allows us to share data and, be covered by HIPAA. So it's the employees that are essentially interacting, and it's because they're on a larger attack surface because of those interactions, what I heard.
Right.
Yeah.
Yeah. So, you could be saying, hey, you've contracted with me to do some coding work for you. So here's my, go log on to my SharePoint, or another collaboration tool, and go download my coding work. By the nature of having to interact with those sort of apps and clicking on those links, it means you work in a vulnerable way.
Right. Okay. Fascinating, and I think extraordinarily useful for folks. And obviously, one of the things that Proofpoint does is goes and looks at that, and you've discovered that. Let's dig in a little bit. You've talked about some of the reasons as to why the information is attractive, the sort of rich nature of that healthcare information. But let's dive in. We're seeing this big uptick, inevitably, associated with the SARS-CoV-2 and COVID-19 explosion that we're all dealing with. But that's created, whilst it's creating challenges for everybody, it's created opportunity in this world of cybercrime. Tell us a little bit about what you're seeing around that notion and some of the approaches that they've taken.
Well, I don't want to venture into the world of hyperbole here, but this is the single most comprehensive campaign that Proofpoint researchers have seen in years.
Wow.
In terms of how this topic, COVID-19 in particular, is being used as a lure to go compel people to download or files or interact with malware, and it would serve as a useful case study to understand the sophistication of the cyber criminal networks out there, their social engineering expertise, and their attentiveness to what the news cycle is. So let me give you a few examples.
Mm-hmm.
We've been noticing these lures appearing really in January, and the lures were back in January were along the lines of, "Hey, you should be aware of this virus. It's coming, and here's some frequently asked questions that you might want to ask some answers to." And these lures are being sent from seemingly, upon first glance, from organizations who you would expect them, World Health Organizations or national health authorities. So they're what we call an imposter email, type attacks. So this is in January, right? So in January, they're talking about, hey, this is coming. You might want to learn more about this. There's some preventative measures you could take. Well, as the news cycle has evolved, so have their lures have evolved. So that was very much yesterday or last month, 2 months ago news, but it evolved to, here is some impact of our travel restrictions. So download our most current travel advice. Oh, by the way, now you can't get access to medical equipment, or you can't get ventilators, you can't get masks or whatever. Here we have an access to masks for you. So come download and approve this invoice. Oh, by the way, there's a secret cure out there. We have, it's the government's not telling you this information, but we have access to a secret cure and vaccine. Come download this information. Now it's all around stimulus checks. So now, of course, they recognize we're at this stage of the news cycle. So now it's like, oh, have you not had your stimulus check yet? Oh, we can tell you how to get that. Or, here is your stimulus check, or come download information to go get your stimulus check. So as the news cycle has evolved, they have evolved, and they have a level of sophistication that they know which organizations they should be impersonating. So is it a health authority? Is it a tax authority? Is it a medical device supplier? And they know how to construct an email and they're not always perfect, but they look like an email that is sent from that person. And they're sent within the organization to the people you would expect to receive that email. So they've done their level of homework and say, yes, if it's about, ordering medical supplies, I know I need to send that into the accounts department or to the sourcing department. So like I said, it's kind of a case study of how sophisticated the bad actors have become. Can
I dig into that a little bit? You said not to sort of dive into hyperbole, but you did say single most comprehensive campaign. And when you say that, the question I have is comprehensive in that this is coordinated across multiple groups, or it's just because this is such a big focus, there's many people that are, is this large entities that are doing this, or is this small groups that are just essentially using the same principles?
So when I say the single most, I do recognize I use hyperbole,
I think it's valid, entirely valid. I'm not questioning it at all.
No. We're good. So when I say it's the from a volume standpoint, we have seen what our researchers would talk about, basically a staggering rate of volume and a very sophistication of targeted. So, and it represents, the theme has always been around COVID. So it's multiple groups who are using it. So it's not just one set of cyber criminals. There are multiple bad actors who are using this. But it's the first time we've seen in years that you have essentially an attack being launched on one theme, and that theme is just evolving. So we have some data here I can talk about here. So we've observed in our research, we've observed more than 500,000 messages around, with COVID as the lure, 140 disparate campaigns, so various campaigns where they're trying to use COVID as some sort of technique to go compel people to go take an action, download data or whatever. We've seen 300,000 different malicious URLs related to COVID being spun up.
Wow.
And we've seen 200,000 different attachments about some aspect of COVID.
So in the limited amount of time we've got left, could you help the listeners in terms of the way in which they can try and deal with this? I mean, it's clearly wider than the main attack surfaces that you described, but what are the things that people can think about that can help defend against this?
I think the number one lesson I would say, whether you're in a health institution or not, do not click or download any information based on fear or emotion. Right? If that email is playing on your fears or the emotions, it's probably a bad idea to download that. And if you think you need information that email has, go source that information directly from the institution it's purporting to come from. Right. So in our example I cited a little bit earlier, where the World Health Organization was having imposter email sent up on their behalf, go to the World Health Organization and go to them directly and go seek that information from them. But yeah, do not let fear or emotion be your driver to interact with these sort of emails.
And is it just exclusive to email, or does it extend? I mean, I'm aware at least of WhatsApp. There's a Google Docs that's working where people are coordinating, and those are essentially other attack surfaces. Is it as significant in those environments, or is it really predominantly email? I mean,
email certainly still is the main point of compromise by a long way. But yes, you're absolutely right. There are other channels, social media channels as well, that people are using to go try to spread this information. And people are trying to compel you to go download information or click a link using those channels. So yeah, absolutely. And I think the same principle would apply. Don't use emotion or fear as your driver to interact with that piece of that message or that content.
So no matter the source, the primary sort of guidance here, which I think is really helpful, is if that pulls at your heartstrings or emotions or whatever, take a breath, stop, and find another way to get to whatever it is that's presenting to you. I think that's great advice in this current circumstance, no matter whether it's email or coming in other instances.
Yeah, and I think that would be, if they could do one thing, that would be my one piece of advice that everybody could implement immediately, right?
Fantastic. Well, as usual, we've run out of time. I just fascinating insights into the whole challenge of security in the healthcare setting. Obviously, some enormously useful context to the various places where these folks attack. This enormous coordinated campaign, which presents just even more stress and worry for the folks that are challenged. Really appreciate you coming on the show today, Ryan. Just remains for me to thank you for joining me on the show.
Thank you very much. And I think it's very worthwhile to be aware of what's going on and the tactics that are being used, and just use your best common sense when you interact with this information. And people are being attacked, but they're also our best form of defense. So the more awareness you can have of this challenge and the exploits are being used, the more likelihood we can help all collectively thwart these cyber criminals.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.